Hello, and thank you for joining me for another episode of Surgical Instruments Explained. Before I start this one, I just want to say I'm in no way a professional with this instrument. I do not work in labor and delivery, but I came across these instruments and I thought they were really interesting and just thought it'd be neat to explore how they're used and why they're not used very much anymore. So what I have here is a Tucker McLean delivery forceps. Now there's many varieties of delivery forceps. This is just one of them. So throughout the video we'll kind of explain how these work, and I'll demonstrate on one of my daughter's dolls how they go around the baby's head to assist with delivery. Now these aren't used very much anymore. They've kind of come out of favor over the past 30 years. In fact, I think they're used in about 1% of vaginal deliveries today on average. So they've really fallen out of favor, and there's different reasons and speculation as to why that is. Vacuum assisted delivery has become more common, and there's pros and cons to both methods of assisted vaginal deliveries, I guess, if you will. So again, I'm in no way a professional with this tool. I've never even seen them used. Just thought it'd be interesting and a neat thing to highlight in the video. So going forward, we'll see how they work, how they fit together, and what they do. So let me introduce you to Perry, and she's going to be my assistant in the video today, demonstrating the vaginal forceps, and I will do my best to make sure she comes out of this completely fine. Okay, so when we talk about positioning of the baby during delivery, the ideal position for the baby's head and whatnot is called occiput anterior. And what that means is just the occiput, the back side, posterior side of the skull, is going to be facing mom's front. So the baby will be facing mom's back. And this helps to put pressure on the cervix while coming down the birthing canal. And that's just the natural, from my understanding, the best position for baby to come out during a vaginal delivery. Now I'll show you what it looks like to apply these delivery forceps. They're going to come in and go around baby's head like so, and around the cheek. Now these will come in from both sides, and then the instrument interlocks at the handle, and they're able to hold the baby's head in position and gently pull the baby through, assisting with that vaginal delivery. Now as you can see, it's pretty clear why there's risk for injury there. And again, I'm no way professional with this, just want to throw that disclaimer out there again. Just reading up on the internet in different articles. So one of the things they talk about is not rotating baby using the delivery forceps, just using forearm strength and gently pulling down with contractions to assist in the delivery. Now here I'll just show you how the instrument latches together, or fits together, I guess. It's just two separate pieces. So one side would go in, other side would come in, and then they fit together at this hinge, creating the handle. And while these are called blades, they're not sharp, they're rounded. This would be referred to as the toe of the instrument, and this would be the heel. Alright, so I hope you found this video informative and maybe interesting. Again, I don't want to be controversial with this instrument. There may be some people that have had terrible experiences with this, and I understand that. I'm just highlighting what this instrument is and what it's used for. I don't have an opinion on the efficacy of it or anything like that. So, but as you can see, like the way it holds the baby's head, some of the risk for injury is pretty apparent. You have, risk for nerve damage there, and any rotation of the neck injuries. There's risk of facial lacerations, and then risk to the moms as well. There's risk for vaginal lacerations, trauma associated with that, and tearing and whatnot, just normal, I guess, if you will, risks of delivery. So if you have any questions, comments, please put them down below. Please consider subscribing. I hope to make more content with other interesting types of instruments like this and different supplies that we use in surgery. And any suggestions for the video, let me know. Thank you.